Patients with a pink papule problem, or as I call them PPPPs, are common. These pink papules have a long list of possible causes. Fortunately, common things occur commonly in general practice. This 40-year-old lady had noticed this hard papule 2 years previously on her upper right arm. It hadn't changed in size, but had become a little itchy recently, causing her to seek medical review. List the signs you see in this lady and give me your diagnosis and management plan. Note her lighter skin type. The papule is around 5 mm in diameter and it's pinch test positive. This happens because the papule itself is tethered to the underlying dermis, so you can't lift it up, unlike the surrounding skin. Estimates vary, but around 70% of dermatofibromas are pinch test positive. It's not diagnostic on its own, but it's a useful and common finding. I hope you like the dermoscopy, noting the changes as I switched from polarized light to non-polarized light settings. These white dots are called rosettes, a type of shiny white structure formed by a keratin-filled adnexal skin opening. Note how the white dots are circles on non-polarized light, but under polarized light are the 4 dots of a 4-leaf clover that we call a rosette. It's an optical artifact and not a histological feature. They are most commonly seen in actinic keratosis, but here I think it's just background sun damage, because note under the ultraviolet light how the keratin shows up as white clear dots, and some are visible on the surrounding skin. So for diagnostic purposes, I think these are red herrings. We have another type of shiny white structure centrally, a lattice that shows up again only on polarized light. The tan colour is rather homogeneous and fades out at the edges with no clear pigment network pattern. The vessels are a patchy dot variety. The history, its location, and the clinical findings made me suspect this was a dermatofibroma, and nothing on dermoscopy persuaded me otherwise. She was looking for reassurance it wasn't a cancer, and I gave it to her, advising a return should it get any larger or any further changes, and it was best left alone. Dermatofibromas are most common on limbs, the dermoscopy being classical in only around 30% of them, there being many other different types. There is some crossover with melanomas because both often have shiny white lines, pigment networks and dotted vessels, so if you have any doubt, refer it or cut it out.